Your body truly has the innate ability to heal itself. I went off my medication. I'm like, you know what? I'm going to see what I feel like not taking it, because your body truly has the innate ability to heal itself. Well, if I'm healing and doing all of the work inside, maybe I've healed my thyroid. And sure enough, my thyroid labs aren't any much different than they were when I was on the medication. And I feel no different from being off the medication than I was taking the medication.
Super excited to chat with Dr. Erin Ellis. We're going to be talking about thyroid autoimmunity, talking about her Hashimoto's journey, talking about hormones. Really going to be a great conversation.
And I had this underactive thyroid. So I had hypothyroidism. I was on natural desiccated thyroid for years. And all of a sudden I had like a 42-day cycle, which was very rare for me. I'd never had a long cycle. I was always clockwork every 28 days. So I was like, you know what, I'm gonna do my labs and check on my hormones and such. And then I had this antibody response. So I'm like, holy cow, I have Hashimoto's. The only symptom necessarily was the prolonged cycle. I sit here and I help women every day get to the root cause as to why they have their symptoms. But I never really thought about, like, why is this happening in your body? Like, why can't I get healthier? Like, why is all this stuff happening to me when I've never been healthier, right?
So let's talk a little bit about more about your background. So, I mean, again, the non-Hodgkin's lymphoma, I'm sure a big surprise, and thankfully you were able to restore your health. And again, that's what motivated you to become a naturopathic doctor. But I guess, do you focus? I mean, you focus on hormones. Do you also help people with cancer too, or is it mainly the?
Yeah, no, I usually refer out to some, board certified naturopathic oncologists for, alternative medicine, but I will support patients post-cancer, trying to get to the root cause of why they had the cancer in the first place. Cause that's what, I've discovered for myself over the last couple of years, is like, why does this keep happening to me? But no, I don't directly treat patients with cancer.
Yeah. Okay. That makes sense. And what led you to start focusing on women's hormones?
Well, I did originally when I graduated from med school. I wanted to do cancer care. And then I was like, no, the reason I wanted to do it is because I could really relate, right? I'd been in their shoes. But I was like, no, this isn't for me. I really found the need to help women and women's health. And I hated women's health when I was in school because it's hard. Women's health is difficult. Hormones are hard and everybody is different. So I was like, why would I want to do, you don't want to do anything that's really hard, right? But then I found the need, and then I really became infatuated with like menstrual health, and the lack of information and education out there for women's health is awful. Like, it's really broken for women, and they're left feeling dismissed and suffering and having these atrocious periods, and then they're entering perimenopause and menopause, and they've lost their life. They don't feel like themselves, and again, they're being dismissed by their doctors and feeling hopeless, and doing all the cardio in the world and gaining weight left and right. And, that's why I was like, you know what, I really enjoy, restoring hope in women that their symptoms are real. We can help them. We just need to give their body the chance to heal and give it what it needs, and they can get their life back. So that's how I got into women's health, and I love it. It's fun. Every day is different.
Yeah. Every day is different. Every woman's different.
Yeah.
So, yeah. And then, so you were diagnosed with Hashimoto. So, can you give that story, like when you were diagnosed and a little bit of the journey?
I had the cancer diagnosis in 2010. I went to medical school. I started in 2013, graduated in 2017. I think in 2015, maybe right around graduation, I did lab work, post med school, and I had this underactive thyroid. So I had hypothyroidism. I was on natural desiccated thyroid for years. And then I, do my labs. Maybe I was doing them, like trying to do them twice a year, maybe once a year. And in the fall of 2020, I threw an antibody response, and I had never had an antibody show up on my labs before, and I would draw them every time. And I all of a sudden had this Hashimoto's diagnosis. And it was prompted after I did labs after I had like a 42-day cycle, which was very rare for me. I'd never had a long cycle. I was always clockwork every 28 days. So I was like, you know what, I'm gonna do my labs and check on my hormones and such. And then I had this antibody response. So I'm like, holy cow, I have Hashimoto's. So I'm not entirely sure what was the driving factor. It might have been the pandemic as far as like the stress goes of it. I had just opened my own practice, Hope Natural Health, in January of 2020, not knowing that the pandemic was happening, even though the pandemic really didn't like affect my practice at all. But still, it's like that world of uncertainty that we were living in for so many months there, not knowing what in the hell was going to happen. So I'm not sure if that was a driving factor, or what I've discovered later in this last like couple years is it could have just been a compounded effect of, all this poor cellular health that I had had for all these years, maybe the chemotherapy and the, all the stress that the medical treatments had done to my body that just, just through this antibody response. So that's how I discovered it, was just through routine labs. The only symptom necessarily was the prolonged cycle, but I didn't have any other thyroid symptoms because I was on medication. And then, that's how it all started, was really, back in 2020 with Hashimoto's. Yeah.
Yeah. So like 5 years prior, hypothyroidism, and then you wanted the desiccated thyroid, but it wasn't until 2020 that you first tested positive for antibodies. And
Yep.
Any family history of Hashimoto's? Or
no, my dad has hypothyroidism, and I think my grandma might have, but nobody that we know of has Hashimoto's. But I'm sure, as you know, like it's not really, tested so much in mainstream medicine. So who knows? They could have had it and not even known it.
Okay. And are you still taking desiccated thyroid, or?
Mm-mm. So I had a real aha moment probably last spring. I see a chiropractor regularly, and I was having, since 2010, I was diagnosed with cancer, and I've been cancer-free since, as far as the non-Hodgkin's lymphoma occurred. I was diagnosed at age 31. The form I had was very rare, found typically in older men. I was 31 and a female, so I did not fit the criteria, and otherwise healthy. Like I didn't think I was unhealthy. So that really changed my life. It changed my outlook on health and wellness. Like I became healthier. I actually started eating vegetables. Like come to find out, like, I guess I wasn't that healthy, but I was a standard American, right? You don't know what you don't know. And I didn't know any of this until I went to med school. And so I continued on with life. I had, in 2022 was like a really rough year for me. I'm 47. So I started doing my breast imaging, at age 40. My mom's had, we also have other cancer in the family. Like my mom's had breast cancer twice, and she's had endometrial cancer, but we've done all the genetic testing, and I don't carry any genes for anything, nor does she. But in 2022, I had some stuff show up on my left breast, which is atypical ALH, atypical lobular hyperplasia. Ended up having a lumpectomy. Right after that, I was diagnosed with malignant melanoma on my back. So I had surgery for that. And then right after that, I had squamous cell carcinoma on my arm. So then that was a really rough year. 2023 was fine. I had all my scans, nothing, everything was clear. And then in 2024, in the beginning, I went for my MRI for my breast, and something else came up in 2 spots. And it ended up being the ALH again, plus some DCIS, which is ductal carcinoma in situ, which is basically like precancer. So I've been going to my mom's breast surgeon because I trusted her and she knows my family history. And she said, Erin, I'm really worried about you. You're like a ticking time bomb. And basically what she told me was, it's just a matter of time before you develop breast cancer, and you should really consider doing a bilateral mastectomy preventative with reconstruction. And, she really kind of put the fear into me, like, oh my God, like I'm going to get cancer again. I don't want this to happen. And for someone that's already had cancer, like it's very triggering, but you also put a lot of trust in the doctors, and because that's their specialty. I'm not trained in oncology and by any means, or surgery, or, in breast health. So I had gone to my chiropractor, and I had told her, I'd gone to see a breast surgeon. Like I went to see the breast reconstruction surgery. Like I had gotten all the estimates to figure out how much this was going to cost. Like I had, potential surgery scheduled. Like I was thinking about it. But then she asked me, or she didn't ask me. Well, she did ask me, but she made a very nice, interesting comment. She goes, a surgeon's job is to do surgery. And she said, have you ever thought about why this is happening to you? And you might agree with me, but doctors are the worst patients. I sit here and I help women every day get to the root cause as to why they have their symptoms. But I never really thought about, okay, Erin, why are you having these symptoms? Like, why is this happening in your body? So she gave me a name of a lady that I should have checked out or listened to a podcast, and it's Dr. Jen Simmons. And
Yep.
she opened, I mean, light bulbs went off, and I'm like, holy cow, this is like fascinating. I canceled everything. I'm like, I'm going to get to the root as to why, one, I had non-Hodgkin's lymphoma, two, why this stuff is happening in my breast, three, why do I have a skin cancer? Like, why can't I get healthier? Like, why is all this stuff happening to me when I've never been healthier, right?
Yep.
I do all the things. Like I stopped drinking alcohol. I take all the supplements. I exercise, I sleep, I meditate, I cold plunge, I sauna. I do all of the things. I do way more than the average person. So I started working with another naturopathic doctor because I'm like, I'm not managing my health. I don't want to. And I had done tons of testing. And she put it all together for me. And moral of the story is I do have a lot of SNPs or genetic dispositions that essentially put me at a disadvantage. And I think I've been at a disadvantage for a very long time, which, was made the ability for the cancer to grow in the first place. Because cancer really is a normal response to an abnormal environment. So I had an abnormal environment that developed this cancer, and I haven't fully restored myself since then. So anytime I get quote unquote assaulted by, like, say, environmental toxins, pesticides, stress, you name it, like it's literally like I'm getting attacked. So I have to work a lot harder than the average person to, I guess, heal myself. So I went on a really strict detox protocol. I've been doing glutathione pushes because I also found out that I have a genetic disposition to glutathione. And glutathione, for anyone that doesn't know, is our body's most potent antioxidant. And I burn through mine. So I need more. And who would have thunk I needed more? So I actually give myself intravenous pushes once a week. I was doing them twice a week to really boost myself. I was doing a lot of like cellular health. So I did an antioxidant or oxidative stress test on myself. And it said I basically had the cells of I think it was a 68-year-old person. And at that time I was 45, I think. So 20 years older than what I should be. So I did a lot of like cellular repair and restored mitochondrial function, really cleaned up my diet, watched pesticides, ramped up my sauna use because I had to work a little bit harder. I was doing the things, but I still needed to do more of the things. What else did I do? I mean, that's pretty much like I was on this strict supplement protocol, a lot of supplements for about 6 months. Meanwhile, I realized that, or I decided I was not going to do any more mammograms and I was not going to do any more MRIs, but yet I still had this DCIS in my left breast. Well, I had the imaging in April, I think March or April of last year. And then I went for a QT scan because I learned that from Dr. Jen Simmons about this qualitative transmission test for the breast that's actually 40% more sensitive than a breast MRI. And we're lucky enough to have one here in Arizona. So I was like, I'm going to do it. Went and did it. They compared my scans from my MRIs and my mammograms from March, and there was nothing there. So what I had done had completely reversed or reduced or got rid of whatever they said I was a ticking time bomb for, and wanted to remove both of my breasts and go through this extensive surgery and have all these antibiotics, probably disrupt my gut, like even put me more at a disadvantage than I already was if I had done this surgery. So since then, I have done other testing. I actually just did testing last Monday, and my environmental toxin markers have gone way down. But more importantly, like I have my antibody response has gone from my Hashimoto's. Like I have no more antibody response. My thyroid, like I went off my medication. I honestly didn't mean to go off my medication. It wasn't intentional. I ran out. And my refill didn't come in time. And I'm like, you know what? I'm going to see what I feel like not taking it. Because your body truly has the innate ability to heal itself. And I'm like, well, if I'm healing and doing all of the work inside, I'm like, maybe I've healed my thyroid. And sure enough, like my thyroid labs aren't any much different than they were when I was on the medication. And I feel no different from being off the medication than I did taking the medication. And like I said, my antibodies have now been negative for over a year. So that is pretty much my health journey in the last year and a half with Hashimoto's, and just, getting to the root cause of probably that and the cancer diagnoses I've had.
Yeah, that's an awesome story. That's great about the the QT scan being negative, as well as yeah, those antibodies coming back negative, not having to take thyroid hormone. So you said about a year. It's been a year since your antibodies were
Yeah,
last
I
positive.
think, yep, I think they were negative. Well, the other thing that I have been taking is low dose naltrexone,
Okay.
or LDN. So I have been doing that at 4.5 milligrams. So I'm pretty sure that might have, a role in reducing the antibodies and the inflammation in my
Hmm.
body. I'm still taking that. That is the only medication that I do take.
Okay.
But I believe it was October of 2024 that I had no antibodies. And then I just tested again here in September and they're still negative
Okay. And how long have you been taking LDN for?
since about July of last year.
Okay. And I mean, if that is the case, I think I mean, the one thing, like, is it better if you had to take LDN and let's say that's suppressing the thyroid antibodies, or to take thyroid hormone replacements? We could argue that LDN is a better option because at least it's preventing further damage to
Mm-hmm.
the thyroid, where
Yep.
if you take thyroid hormone, it's not doing anything for the immune system component.
Yeah. And I never saw, honestly, a reduction in the antibodies with taking MP thyroid. The other
Yep.
thing I also do is I don't eat gluten. That was the first thing that I pulled from my diet when I was diagnosed, when I found out I had Hashimoto's. I mean, I'll eat it every once in a while, but I feel like it's less aggravating to my thyroid now than it was. Like if I
Okay.
used to have a
Yep.
bit, like I could feel my thyroid, it just felt mad and angry, and then I just didn't feel good when I have gluten. So now I can tolerate it a little bit. I still don't eat it. I don't like it. But I mean, we're humans. Sometimes we're in instances where there's gluten and I'm like, "Oh, I'm not going to starve. I'll eat the gluten," right? Or you're at like a family dinner and you're not going to not eat cuz mom made you pasta with gluten. It's like, "Well, I'm going to eat." So, yeah, but that's the other thing that I do avoid is gluten. I still eat dairy. Dairy doesn't seem to aggravate me, but to each their own. Everybody's different.
Okay. And can I ask you what you mentioned, the oxidative stress test? Can I ask you
Yeah.
what that is? What
So
you
there's an oxidative stress panel through Vibrant America.
Okay.
It's newer. Yeah. So I did that. I haven't gotten my latest results back yet, but it basically said like my cells were in like a war zone. So I was doing a lot of like phospholipid health and like, trying to restore the cellular membranes so that I could, restore, mitochondrial function that I think I was at a disadvantage for. And that's why I was just getting assaulted and why all these things kept happening.
Yeah, and that's a urine test or a
Yeah.
blood test? Okay, urine
Urine.
test. Okay.
Yep.
All right, cool.
And
And then
the other thing
mhm.
I want to point out that I found out that was really cool, because there's always, and what I hope I can inspire like people is that there's always a why. Like you don't just get these things for like because it's bad luck. There's always a reason why these things happen in our body. And so one of the reasons I discovered probably from the non-Hodgkin's lymphoma is there's a huge correlation between non-Hodgkin's lymphoma and glyphosate. And I had high glyphosate levels. I still have high glyphosate levels. They're not as high. They're now in like the low end of like normal, but they were really high. And since they were high, and glyphosate is found in most pesticides, like Roundup is the most common one. So my glyphosate levels are really high, which probably was the reason why I got the non-Hodgkin's lymphoma. I mean, I don't know any other reason why, if it's found in like older men and I'm a 31-year-old woman, like why is this happening? But again, like I had these levels, but my body wasn't able to like get rid of it because of that, the poor detox pathways I
Mhm.
have. So working on that again, like has been able to get, some of these toxins out. So I thought that was a fascinating correlation too.
Yeah, I tested for glyphosate, did organic acids test and added
Mhm.
glyphosate. I think in 2016 was the first time, and it wasn't crazy high, but definitely was there. And then so
Mhm.
I did things for supported detoxification, did a
Yep.
retest, and it was still there, but it was lower. And
Yeah.
I can't say I test everybody, but when someone I don't know if I've ever seen zero glyphosate
No.
levels, just because it's so widespread. If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter.
Yeah. I was going to say most everyone probably has BPA and glyphosate. Like those are the two. And my BPA is still high and my glyphosate is still high. So, but it's not like as high as it was. So again, doing the work, it's just like I have to continue to do the work is what I've learned. Like I'm just at, I mean, I might get to a point where I don't have to do the work, but I also have these genetic SNPs, like these issues, genetically that I can't do certain things. My body just doesn't do it. That's how I was born. So I probably will still have to work hard for the rest of my life.
Do you still do the IV glutathione pushes?
Yeah.
Okay, you still do that once a week.
Yep, I still do once a week. The good thing is my fireman, he's a paramedic, so he pokes me. But yeah, I still do those once a week. I don't mind doing them. I mean, yeah, it's monotonous, but if it's going to keep me healthy, honestly, like that's why I love testing, because then you see the progress that you've made, and then it makes what you've been doing like so much, like you get like validation, and it's like, okay, what I'm doing is working. So that it doesn't matter. I don't mind doing it if I know it's working. Maybe I can go every other week, but I mean, I took oral glutathione when I was on vacation. It doesn't work. I mean, it's okay, but it's not as effective as doing, IV glutathione. So if that's what's going to keep me healthy, then I'm fortunate enough to be able to do it myself, that, I'll continue to do it.
Yeah. And then you mentioned the sauna to help sweat out the toxins, and anything else to support your detox pathways.
Yeah, I've done, I do coffee enemas every once in a while. I do vibration plates. I do lymphatic massage. I forgot that one because I had lymphoma. So I had cancer of the lymph nodes, and your lymphatic system is really how we detox anyways, but it's the only system that doesn't move. We have to move it. So that's why we always preach, like, you got to move your body, but like manual lymph drainage is good. I actually had developed, I still have it. It's, really incurable, is lymphedema in my right leg from the cancer. Cause I had a tumor by my bladder was where the lymphoma was. And so over time, I guess I developed this. Didn't happen until probably 6 years after cancer, but I have lymphedema and swelling in my right leg. So I do the lymphatic massages just to get, stuff moving on a manual basis and to help my detox pathways. What's interesting is I started doing those earlier this year, perhaps. I did like a round of 4 or 5, I think. And then I went on vacation. I was like behind on them. Like I try and go every 6 weeks now that I'm on like a maintenance schedule. And I think I went over 2 months, and I had just had one a couple of weeks ago, and she goes, "You were pretty stuck." And so it just goes to show me like these things work. And so I need to keep up on them. And plus I was out of my routine. We were on vacation and traveling, and I didn't have the sauna. I didn't have my vibration plate. And I'm like, all right, and I tell that to my patients too. I'm like, if you don't think that the supplements you're taking or what we're doing is working, then stop them. And then I guarantee you're going to feel like, oh, okay, you're going to feel different. Like, yeah, they were working. And sure enough, they're like, oh yeah, I did feel better when I was taking my supplements, or, oh, my labs did look better when I was taking these things. So yeah, like I said, it's validation that what I'm doing is working. So I'll continue. I'm trying to think what else I do. Mainly like just a few supplements. Like I do some detox supplements. Oh, I've been doing a lot of like gut work, even though I don't have like any issues with my bowel movements. Like I have healthy bowel movements, but I've been doing a lot of like a gut healing protocol. I've done like parasite cleanses. What else? Candida work, like all of that. I mean, I think everybody has that to an extent. So I've been really working on my gut lately, and working on my stress level. Not necessarily like stress. I just did a post about this on Instagram, but like, I'm not stressed. Like, yeah, I own a business and I'm busy, but I'm not stressed. And my Aura Ring like would tell me all the time that I'm stressed, and I could not figure it out. And it would tell me I was stressed when I was sitting there watching television, like a mindless reality show that's like not stressful. Like, why is it saying that I'm stressed? And then I was like, all right, well, this has to do with my healing process. And like my body's just under a lot of stress and it's trying to heal. And I swear within the last like month or two, after I've been doing like obviously working on this stuff for over a year, and now the gut stuff, like My stress levels are way down. My HRV levels have gone way up. Like I really feel like, like I've turned a corner per se, as far as like my body's actually like working again, which is really good.
Yeah, that's awesome. HRV, for those who aren't familiar, heart rate variability, and that's from the Aura ring, like the HRV levels on the Aura
Yep.
ring have increased.
Yeah. And like I used to have readings in the 20s and 30s. And I look at my patients' Aura data all the time and I'm like, man, you have some good HRV. I'm like, what's wrong with me? And then now I'm in the 70s. I'm like, what? It's awesome. Except the luteal phase. So women, if you are listening and you have an Aura ring and you have crappy readings in the luteal phase, that's pretty normal, especially right before your period. It's okay.
Okay, good to know. And how frequently do you do sauna and the vibration plate when you're home?
Another thing I do is red light, but that goes with everything. I do the sauna. I try and do it 4 times a week. There is research that if you do it 4 times a week for at least 20 minutes, you have like a 40% all mortality reduction, which is pretty awesome. So I try and do it 4 times a week. We just got a puppy, so my routine has been just not normal. And I usually do the vibration. Well, I go to the gym, come home, I'll turn on the sauna, make my breakfast, do my vibration plate, do the red light in the sauna, take a shower, and then I'll do the cold plunge after that. So I try and do it 4 times a week. Sometimes I try and do the vibration plate like every day because it's only 10 minutes. But I've been out of my routine lately.
Yeah. So you do the cold plunge, you said 4 days a week, like after shower, like you do sauna, shower, cold plunge, you said?
Yep. Sauna, shower, cold plunge. Yep.
Okay, cool. I've
Yep.
not done cold plunging yet. I mean, I do cold showers, which I know is not the same, but one of these days maybe I'll be brave enough to do a cold plunge. So.
Unfortunately, in Arizona, we don't get cold showers because our water's too hot. So it's impossible to get a cold shower. I mean, maybe in the winter, but the cold plunge feels real good here in Arizona. I'll tell you that. Mine's outside in our patio. So yeah, it's good.
Yeah.
It's only 2 minutes.
Okay. I was about to ask, I assume just a couple of minutes in there. So
yeah, 2 minutes in the cold plunge. I only keep it at 50. Women don't need it much colder than that. And you don't need more than 2 minutes, maybe 3 minutes, but I just do 2 minutes. 11 minutes a week is where the research is. So maybe I'll throw in an extra day of cold plunge there, but yeah, I like it.
yeah,
Feel good.
very, very cool. And then so during your health journey with cancer, Hashimoto's, did you do any functional medicine testing at all other than the oxidative testing that you mentioned? Did you do any like stool tests or adrenal tests, or did you really just mainly do that oxidative stress test?
Well, with cancer, no. Like I didn't know anything about naturopathic medicine when I was diagnosed with cancer. I met a naturopathic doctor after I had been deemed cancer free. So I didn't really do any functional testing during my diagnosis. And I have done probably every test out there throughout my 8 years of being out of school, but I never really did anything about it. Like I would get the results and be like, oh, okay. Because again, we're the worst patients. I didn't do anything about it. And then most recently is when I did all of the environmental talks. Like I've done an oat test or organic acid test. I've done neurotransmitter testing. I've done heavy metal testing. I've done stool testing. I've done cortisol, awakening response, the 4-point salivary testing. Like I've done Dutch testing. That was actually I really wanted to do the Dutch testing just due to my estrogen metabolism for cancer. So that's the urine test for hormones. What else have I done? I just did another stool testing, so I'm waiting on that. Well, yeah, I've done it all.
When you treated for parasites, did you treat based on the findings of the stool test, or were the stool tests negative for parasites and you just kind of did a regular parasite cleanse?
I did the parasite cleanse because I went at the place I do my lymphatic massage. He does some muscle testing. And so I went to see him just to, I guess, learn a little bit more on a different scale, I guess, or measurable scale. And I tested for a parasite through him and some candida. So I did the cell core parasite cleanse. Do I notice if I passed anything? Not necessarily. Did I feel any different? No, but I'm sure it did good. I mean, everybody has, if you have a heartbeat, you have a parasite. So, but I don't recommend everybody just going out and doing parasite cleanses without talking to your doctor first.
Yeah. Good advice. How about because you deal a lot with hormones with your patients. So like what type of testing? Do you recommend Dutch testing? Do you recommend mainly the blood testing to look at hormones?
I like it all, but I start with blood. And the reason I start with blood is because I'm looking at the whole person, and I can get way more information on blood than I can on pee. But, if I don't get anywhere with blood testing, as far as like hormones, which I usually do, then I'll go to urine testing, like a Dutch test. I actually just ordered a Dutch test for a patient who's struggling with her hormones, and we've been doing a lot of work and we're not getting anywhere. So I'm like, let me see how you're metabolizing. And that's what I can find out through Dutch. But I typically do blood because I can get way more information, way more labs.
So blood testing, and do you test thyroid on most
Oh,
people?
yeah. Well, that's hormone. Yeah. So hormones, like I test a full thyroid panel with the antibodies, adrenal function, like AM cortisol, typically through blood, and then full reproductive hormone panel. In addition to like blood sugar, vitamins, cholesterol, iron.
Okay, wonderful, wonderful. Well, you you mentioned Dr. Jen, who I don't, was she on your? She was on my podcast.
Oh, she was?
Has she been on your podcast yet? Or
No, but I would love her to be on my podcast.
definitely reach out to her. She's great to chat with.
Yeah.
And, I told you about the conference I'm going to. Actually, she was there last year, and she did like her book signings.
Yeah.
Which was
If
cool.
anyone is dealing, breast cancer is such a thing, and I really wish it wasn't a thing. But if anybody is listening that's going through breast cancer or knows someone that's been diagnosed with breast cancer, like go down, get her book, The Smart Woman's Guide to Breast Cancer. I bought it. I didn't even have breast cancer, but I had this DCIS. It literally is like, it just made me feel so much better. And I went down a rabbit hole with her podcast, which is Keeping Abreast with Dr. Jen. I just gave it to a patient today. But yeah, you can learn so much from her. And it really just like made these light bulbs go off in my brain. Like, oh my God, like there's a reason why. And, even like all the imaging that I had done in 2022 for my breasts, like, and then the lumpectomy and then the biopsies, it's like, did that play a role in the stuff happening in 2024? It's like, did it? Who knows? It's things that make you go, So yeah, it's unfortunate that nowadays we truly as a society have to be our own advocates and really come armed with, questions to our doctors and, pose these things like, is there a better way? And then you're afraid to bring it up because then they might think that you're like nuts. It's like, well, I don't want to do a mammogram anymore. I'm not going to do surgery. And then they're like, all right, well, best of luck to you. Like you're an idiot for not doing it. Right. Because that's the standard of care. And we don't have to abide by the standard of care. It's your body. You can do whatever you want. So.
Yep. You're right. So now you do a lot of things, and which is great, but for some of the listeners might be overwhelming. Like, hey, I don't know if I could do sauna and cold plunges and vibration plates and all this. So when you work with someone, let's say you're working with someone with Hashimoto, someone with thyroid autoimmunity, what would you say to start out with? So what like tips can you give with someone? Like, should they start out with a diet and lifestyle? Obviously a good idea to work with a practitioner, but before you get into, I assume you don't like the first consultation talk about sauna, or at least maybe you do. I don't know, but yeah. So what advice would you give someone who was either recently diagnosed or maybe even dealing with it for a long time and just decided, hey, I want to address the cause of the problem?
Yeah. So I usually start with the basics, the foundations, because if those aren't in play, then it's like, okay, we've got to start there. And for me, all of those were in play because I had gone to medical school. I knew all these things. The foundations are sleep, hydration, movement, and diet. So that's where we'll start. And if, sometimes people have 2 out of 3 things dialed in, maybe they have 0 out of 4 things dialed in. So then we'll start dialing them in one by one. It's like, all right, well, if you are only drinking 1 glass of water a day, let's work up to 2. Then we're going to have 3. Like, let's make a goal. If you're, eating processed foods, let's try and replace at least 1 meal with a home cooked meal, teach them. There's just a thing that came out from my naturopathic school, or actually the naturopathic organization, about nutrition and how naturopathic doctors, we get over 155 hours of nutrition in our medical school, whereas medical doctors get 19 hours. That's it in their entire medical school. So we know what we're talking about with nutrition. So we'll usually start there. And food is medicine. we can get a lot of good medicine from food, but nobody knows how to eat. That's why we're such a, diabetic pandemic here, and everybody's obese, and it's just a mess. It's because we don't know how to eat, and it's not anybody's fault. Nobody teaches us how to eat. It's like, all right, well, I'm going to go to McDonald's and get this Happy Meal. Well, that's not food. Like, it's not good for you. And with diet, it doesn't have to be hard. Like, it's just, starting to shop around the perimeter of the grocery store, maybe abide by the Clean 15 Dirty Dozen. If you don't know what that is, it's the Environmental Working Group puts that out every spring. Actually, they put it out in the summer this year. It was a little bit late, but it's the top 15 foods that are clean that you can purchase conventional. And then the Dirty 12 or the Dirty Dozen are the top 12 foods that are treated with the most amount of pesticides and chemicals, and buy those organic when possible. So abide by that. And if you start there, you're doing something. And then, movement, start by going for a walk for 10 minutes. You don't have to do, a 10K, just move your body if you haven't done, movement in a while. And then sleep. I think probably sleep is where I start with a lot of my patients, is because they're not sleeping well, and your body can't restore, it can't repair. You're going to feel like garbage. You're not going to have energy. Then you don't want to eat well. Then you definitely don't want to move. So I get you to sleep. Then you have more energy. Then you want to eat better, and you want to move. So that's where I would start. If those things aren't dialed in, then yeah, sauna, cold plunge, any of that's not going to be really helpful anyways.
All right, that's great advice. Yeah, I agree. I mean, definitely want to start with the foundations. If someone's eating inflammatory foods, they're stressed out all the time, they're sedentary, really going to be difficult to heal. So, or not getting sufficient sleep, like you said. So, yeah, definitely want to start with the basics, and then later on, once they do that, maybe they can incorporate some of these other things: the red light, the sauna, the cold plunges. All these could be great options as well. And yeah, before we wrap things up, anything else that you'd like to share, Dr. Ellis?
I guess my best piece of advice would be just, your body best, and that's, don't stop at no. And if you aren't getting the answer that you deserve and that you want to hear, keep asking. When I was diagnosed with cancer, it's like, I had this symptom, I had this swelling in my groin, and I knew something was wrong, but I just kept getting dismissed. My doctor was like, it's nothing, you're too young to have cancer. And it just kept getting worse and worse and worse. And, I'm like, something's not right. Like, can we get more imaging? Can you send me somewhere? Like, what is going on? And finally we got somewhere. Obviously not the answer I wanted, but had that never happened, I wouldn't be sitting here doing this podcast with you. So, life truly happens for you, but your symptoms are messages, and they're little, it's like your check engine light is going off in your car. They're going off in your body. Like, hey, something's not right here. Let's figure it out. You shouldn't, you should have energy in the day to do the things you want. You should be sleeping soundly. You should be having daily bowel movements. You shouldn't have headaches. You shouldn't have stomach pain. You shouldn't have diarrhea. You shouldn't have crappy periods. Like, if these things are happening, like, something's not balanced in the body. So let's figure it out. You can heal, and you can feel like yourself again.
All right. Well said. And where can people find out more about you? I know you have a hormone quiz. Feel free to share.
Yeah. So I have a hormone quiz. You can find that on my social media or my website. I believe we might have given you the link for that in the show notes.
Yeah, we'll definitely include it in the show notes.
Yeah, I'm very active on social media. I would say probably most active on Instagram. So come find me over there. It's dr.Erin Ellis. Give me a follow. I usually shout out and say hey to all my new followers in the DMs. But yeah, social media, website. I have a podcast. I'm on a little break right now, but I've had 3 or 4 years of podcast, over 200 episodes that you can watch. But I should be back the first of the year.
All right. That's awesome. Yeah, we'll definitely make sure to include all the links in the show notes. And yeah, this was great. Thanks for coming on, Dr. Erin, sharing your story with both, the cancer and as well as your Hashimoto's healing journey. Again, just, I found it to be fascinating, and I'm sure the listeners did as well.
Hope so. Thank you so much for having me, Dr. Eric.
Yeah, you're welcome. Thanks again.
You're welcome.